I can completely relate to this question. I worked in the schools for a lot of years before I had this private practice focusing on speech sound disorders. If you're in the schools, the vast majority of the time you are seeing kids in groups, but most of the evidence-based interventions have not necessarily been studied in a group setting. So we have to adapt those evidence-based interventions to our setting, to our service delivery model. And it won't be exactly the way that the researchers have studied all these interventions in these one-on-one settings in a clinic. But I do have a few tips that I think will help you if you're a school-based SLP. First, differential diagnosis. Is it an articulation distortion or is it a phonological impairment? What type of phonological impairment is? How severe is it? Is it a motor speech impairment like childhood apraxia of speech or dysarthria? It's important because each of those subtypes of speech sound disorders is treated very differently. And if you know what intervention is going to work with that speech subtype, that will help you with your target selection. Because what literature is showing is that sometimes what we're targeting in therapy is even more important than the approach that we use to target it. So once you've chosen your approach, you've spent time on target selection, my third tip is to get high trials. Even if you're only able to see kids once a week in a group, if you've chosen your targets wisely according to the approach that you think is most appropriate for their subtype, and you get high treatment intensity, that means a lot of trials during your session, you will see improvement. So that may mean you have to rethink what kind of activities you're using in your group sessions in order to increase those high trials. So is group therapy always ideal for speech sound disorders? No, but you could absolutely still make progress if you just think through some of these things.